Let's talk about one of those common parenting mistakes that seems really small, but wow, it can have some surprisingly big consequences for your child's health. We're going to jump right in.
So let me just ask you straight up, based on what you've heard, or maybe what you've even done yourself, when do you think is the actual right time to start brushing a baby's teeth? Just take a second and think about it. Okay, this is where we see a huge disconnect. A lot of parents, and it's a totally understandable belief, think you should wait until your kid is a toddler, around 2 or 3. But what the experts say is completely different. They say you need to start the second that very first tooth shows up.
That means for most babies, we're talking about starting right around 6 months old or whenever that first little tooth pokes through the gums. So what's the rush? Well, it's all about getting ahead of the game, keeping their mouth clean from day one, and stopping those bad bacteria before they can ever get a foothold on those brand new, delicate teeth.
Now, this might seem like a really minor detail, but waiting, even for a few months, can cause some pretty serious issues. Let's dig into exactly why delaying is so harmful for your little one. The number one danger here is a condition called early childhood caries, or ECC. See, here's the thing. Baby teeth have way thinner enamel than our adult teeth, which makes them super vulnerable. So when milk or juice or any food hangs around in their mouth, especially overnight, it creates acid that just eats away at the teeth. This can cause cavities to form shockingly fast, often before a kid even hits their second birthday.
And trust me, this is not a silent problem. The signs are often things you can see, and they're definitely things your child can feel. You might notice little brown or black spots on their teeth, maybe even chips. Or you might see them getting really fussy during meals because it literally hurts them to eat. And it's just heartbreaking when you realize it all could have been prevented.
And the damage doesn't just stop in the mouth. It creates this ripple effect. When decay isn't treated, it can make chewing painful, which can lead to poor nutrition. That pain can mess with their sleep, it can even cause speech delays, lead to serious infections, and, down the line, cause their permanent teeth to come in all crooked.
It all boils down to this one simple, powerful truth. Baby teeth are not just practice teeth. They are the essential foundation for a lifetime of good dental health. Taking care of them from the start is absolutely crucial.
Okay, so that was the scary part. But the good news is the solution is refreshingly simple. So let's walk through a quick guide on exactly how to get this right.
For kids from 0 to 3 years old, the steps are super clear. First, start brushing the moment you see that first tooth. Use a soft toothbrush with a really small head, made just for babies. Now this next part is key. Use only a tiny smear of fluoride toothpaste, about the size of a single grain of rice. That's it. Do it twice a day and make sure one of those times is right before bed. And finally, remember, you, the parent, have to do the brushing. A little kid just doesn't have the coordination to do it effectively themselves.
So as your child gets a bit older, the routine stays pretty much the same, with just one tiny change. Once they're between 3 and 6 years old, you can bump up the amount of toothpaste from that little rice grain smear to a pea-sized amount. But again, you should still be in there helping them to make sure they get all the spots. Now, along with brushing, there are a few other habits that are real game changers. First, try to never let your baby fall asleep with a bottle of milk. The sugar in the milk just sits on their teeth all night long. It's also a great idea to cut back on how often they have sugary or sticky snacks. And finally, get that first dental visit on the calendar by their first birthday. It's all about prevention.
So you might be thinking, okay, does this one simple habit really make that much of a difference? Oh yeah, the data is crystal clear. Let's take a look at the proof.
Just look at this number. Studies consistently show that brushing regularly with the right amount of fluoride toothpaste can slash tooth decay in kids by 30 to 40%. I mean, think about that. That is a massive drop in cavities, all from one simple 2-minute habit.
And the research shows this over and over again. The pattern is unmistakable. Kids who start brushing as soon as that first tooth pops up have way fewer cavities than kids who start later. The difference isn't just small, it's huge.
And the benefits actually go beyond just preventing cavities. When parents get this information early on, it helps lock in a routine. You're not just protecting their baby teeth, you're setting the foundation for a lifetime of healthy habits for your child. And that is an incredible gift.
All right, so we've covered the problem, the solution, and the proof that it works. Let's wrap this all up with the single most important thing you need to take away for your family's Healthy Smile plan. If you remember just one thing from all of this, please let it be this simple phrase. The first tooth means the first brush. That's it. It's easy to remember, and it is the golden rule for your baby's dental health. By following that one rule, you are actively preventing so much needless pain and infection for your child. And, let's be honest, you're also saving your family from the stress and the expense of some pretty costly dental treatments down the road.
So I'll just leave you with this final thought. Now that you know the when, the why, and the how, what's that first step you're going to take to ensure your child has a bright, healthy, cavity-free smile for life? The power really is in your hands. Thanks for tuning in.